Kia ora, I'm Ihirangi Heke and I'm 11 years old. I'm going to interview my dad about his work. Hi Dad.
Kia ora.
What is your name and title, Dad?
Dr. Ihirangi Heke. I advise to our Ministry of Health and to a number of Māori health organisations nationally. We have a health promotion agency which use various formats to deliver health promotion initiatives and concepts. We have Toi Tangata, which is a national Māori physical activity and nutrition provider, and we have Māori health organisations nationally that are funded by our Ministry of Health primarily. We have recommendations from our Ministry of Education for our kids that it's minimum of 2 hours per child per week, but this is dropping because of the competition with other topics.
Were any of these policies successful and were any unsuccessful?
Mostly they are unsuccessful in our country at the moment, otherwise we wouldn't be experiencing the rates of obesity that we have. We're in the throes of a fourth term with a neoliberal government that's interested in the devolution of power into communities, along with the blame for any health issues, and with no extra funding to try and address it. We don't have incentivised ideas in New Zealand, but it's been suggested on a couple of different platforms that we look at tax breaks for purchasing of fruit and vegetables, removing our goods and service tax, which is 15%, or imposing taxes for any foods that have high sugar content. We have the Healthy Families New Zealand initiative that's been running for 2 years, and that's based on a systems concept. But I think the issue there is that a number of our organisations aren't aware of what systems, dynamic system science, and what systems in general mean. So there's a lack of training expertise or those that are proficient in understanding what systems means. I've assisted a number of initiatives aimed at Indigenous groups. One is the Mobile Wānanga with Dr. Ihi, which is a Facebook site that was a roadshow to a number of different communities looking at their environments and how they could assist physical activity and nutrition. We also initiated the building of virtual tours using Google Earth that allowed us to showcase the environmental attributes of a location as it connected to Indigenous people, and to be able to transmit and share those files with other Indigenous groups. There hasn't been progress to that point yet, but we've finished the recording of our first 5 virtual tours. We've recently finished some work with a research pilot with Johns Hopkins that looked at system science with Indigenous groups in Aotearoa, and we see great potential generalisability and processing utility for other Indigenous groups, if not mainstream. Well, I think we need to increase the transparency of some of the initiatives that we're attempting to initiate, so that the potential funding groups, and I mean transparency from their perspective, are able to tell us why or why they wouldn't support what we're doing, so that we have a better chance of getting some of these systems-based initiatives off the ground. We are in a difficult situation at the moment because we understand it's a complex problem, that we need to have innovative ideas to address it, but we're part of a society that's still trying to use quite linear approaches to address it. For us in New Zealand, because we live so far away from so many other places, it's a long journey to get here, but we found that engaging with places like Johns Hopkins, with other systems specialist groups, we're able to create leverage through engaging with international bodies, having our work accepted in global settings, and then showing that back to our government to say that actually New Zealanders and Māori have something to contribute globally, so that we can create some traction.
Okay, that's all the questions. Bye, Dad.
Bye bye.